This is the Community Meeting offered by S.A. Nichols Brokerage, a marketing plan to help you reach seniors in your targeted selling area. Before you start your electronic presentation, start with this video. Which Medicare plan is right for me? It's going to be a great video to break the ice and get people talking about their Medicare health plan choices. Now take a look at this great video by UnitedHealthcare AARP.
So, how do you decide which Medicare plan is right for you? A good question, huh? First up, get yourself a pencil and paper, and we'll get started. Okay, ready? Remember, if your current health insurance meets your long-term needs, or if you'll get retiree coverage from your employer, then you're probably set. But to be safe, you should check to see how their health plan works with Medicare, and if you still have to sign up for Parts A and B. But for most, you need to pick a Medicare plan to make sure you have all the coverage you want when you need it. When you first become eligible, usually around your 65th birthday, you'll want to ask yourself a few questions to figure out what kind of plan would work for you. Things like, are you in good health? How often do you see your doctor? Do you take a lot of prescription drugs? How much can you afford each month? Are you willing to change doctors if it means lower health plan costs? Questions like that. Next, apply for Medicare and see if you qualify for extra help paying for your medical and drug plan costs. Your local Social Security office can help, or go to Medicare.gov to find out how to apply. Now you'll want to review what plans are available in your area, what the plans cover, and what they cost, because one size does not fit all. For instance, Original Medicare Parts A and B covers some but not all of your hospital and medical expenses and doesn't include prescription drugs. You can add a Medigap plan, sometimes called a Medicare Supplemental Plan, to Original Medicare to help fill the gaps for costs not covered by Parts A and B, and you can add a Part D plan to get the prescription drug coverage you need. Or, if you prefer, you can choose a Medicare Advantage plan. It's a single plan that combines Parts A and B with extra benefits like hearing, vision, gym memberships, and prescription drug coverage. So, review, compare, decide. Keep in mind, you can select a new plan once a year during the annual enrollment period if your needs change. But take the time when you first become eligible for Medicare to select a plan that meets your needs for the next year. And those are the steps to choosing the right Medicare plan for you. Still want to know more? Go to Medicare.gov or check the other videos in this series at MedicareMadeClear.com.
Now here are the do's and don'ts and the points to drive home when doing your electronic presentation for Medicare supplement plans. One of the first do's and don'ts is, on AARP, explain the relationship and the branding, and then move on. AARP sells its branding to many insurance carriers for many products, so there's no reason to labor it here. On the ABCs of Medicare, explain the people's election periods and explain to them what Part A, B, C, and D are and what benefits it can provide them with. It's a great opportunity to set yourself apart. It'll be important here to spend time on what Medicare Parts A and B cover. Make sure you spend time on Medicare Part A and that it's an in-hospital part of the program, and that when you get to Part B, you're talking about what it covers as far as doctor services. You're also going to want to spend time on what Parts A and B do not cover, so they know what they need a Medicare supplement for. When you get to this screen about why choose a Medicare supplement plan, spend time here explaining that with a fixed premium, budgeting is a great benefit. Also, they have the convenience and the flexibility to go to any hospital or doctor that accepts Medicare. Will also be a big selling point to folks looking at Medicare supplement plans. You're also going to want to take a moment here to introduce our next video, which will explain the great benefits involved in buying a Medicare supplement plan. Take a look and see what you think.
Wondering whether a supplemental plan is right for you, or just wondering what it is? Well, we're here to help. Medicare supplemental insurance plans, called Medigap plans, are designed to help pay some of the hospital and medical costs not covered by Original Medicare Parts A and B. Medigap plans are offered by private insurance companies, and here's how they work. Medigap plans help cover some or all of the costs that you pay with Parts A and B, like deductibles, copays, and co-insurance. They also let you choose your doctor or provider. And they travel with you if you move or travel within the U.S. They don't cover things like vision, hearing, dental, or long-term care. And they don't cover prescription drugs. But you can choose to enroll in both a Medigap plan and a Part B prescription drug plan for more complete coverage. Policies and prices vary by insurance company, so it's important to compare monthly premiums, the type of coverage you'd get, and what your total monthly and annual costs would be to be sure it fits your budget. Generally, you have to be enrolled in Medicare Parts A and B to buy a Medigap plan, and you have to continue to pay your Part B premium. Keep in mind, with a Medigap plan, you pay your Medicare Part B premium and your Medigap plan premium. But there's more, and it's important, so listen up. If a Medigap plan is right for you, the best time for most to buy one starts around 6 months from when you turn 65. If you sign up then, you can't be rejected or charged more for a prior medical condition. So take the time to review, compare, and decide what makes sense for you. And that's Medigap. Still want to know more? Go to Medicare.gov or check the other videos in this series at MedicareMadeClear.com.
Here's a screen that you're going to want to spend some time on. The Medicare Supplement plans offered by AARP. Plans A through N are offered. Take time going over the features and benefits of each plan. Take questions from the audience and make sure you answer them thoroughly before you move forward. Now here is a screen that your audience is surely going to appreciate. After you go through all of the Medicare Supplement plans, the question is going to be, how do I narrow my choices? Here are 3 great suggestions from AARP about how to narrow that down. Do they prefer a plan that pays money to cover copays and coinsurance? Or do they want lower premiums for a share of the coinsurance and copayment? Do they prefer to have a lower monthly premium in exchange for using a hospital network? All great questions in helping people pick the right Medicare supplement for them. Folks may ask you, how does a claim work with Medicare and a Medicare supplement? Well, this screen puts it into action. It will show a couple of different plans and how it would work if someone had just original Medicare or if they had a Medicare supplement. I think this drives home the point of the value of a Medicare supplement plan as opposed to just having original Medicare. Spend some time here and go over this claim and answer all the questions that you can on it. The Medicare supplement industry is very competitive. People might ask you, why would I choose AARP for my Medicare supplement insurance plan? Here you can drive these points home. Value. Tell them they can't be singled out for a rate increase, and that the national average annual rate increase has only been 5.5% over the last 5 years. Service. 96% of all plan holders with AARP are very satisfied with their program. Experience. 2.9 million members makes it one of the largest insurance pools in the country. Stability. It's the only Medicare supplement insurance plan available in all states and the only one to carry the AARP name, trusted by millions of seniors. Of course, the AARP Medicare Supplement Plan comes with more than just the health insurance program itself. They get a 24-hour nurse line, vision discounts, and the very, very popular Silver Sneakers fitness program. Make sure you spend time on this slide to let them know there's even more to the benefits of buying an AARP Medicare Supplement insurance plan than just the healthcare plan itself. Medicare Supplement eligibility might seem obvious, but it's not. Make sure you explain to your audience that they have to be enrolled in Medicare Part A and B at the time the coverage begins, be a resident of the state in which the coverage is being offered, and that they have to be age 65 or older, or they could be under age 65 if they are on Medicare disability. Have questions or need advice or just want to discuss the Community Meeting program? Call us at S.A. Nichols Brokerage, 800-283-0040. You want to schedule an event? Call the United Healthcare Producer Help Desk at 888-381-8581. There is more marketing video training available on this page. The Community Meeting Seminar Prospecting Program, other presentation do's and don'ts for Medicare Advantage plans, Part D, and special need products. Also, There's information on here about how to properly use the Agent Toolkit so that you can create the AARP advertising and marketing pieces you're going to need to promote your community meetings. Also, check out the video on the powerful prospecting tool of the Social Services Checkup. This is a great way to meet more and more prospects and bring them valuable information that they need. This is Scott Nichols, president of S.A. Nichols Brokerage, thanking you for your time today. Now plan your work and work your plan. Good luck and good selling.